I chose to work at Meritas Health after looking at quite a few practices in Kansas City, actually. One of the big draws to this hospital and this clinic was the community. I feel that everyone's very tight-knit. I love working with my partners in clinic. We are always looking out for each other and for the patient.
I chose Meritas because Meritas has a great reputation in the community, both amongst patients, but also amongst fellow physicians. Physicians say it's a great place to practice medicine where patients come first, and we can really focus on doing our job rather than other external factors.
Meritas Health has offered me a position where I'm doing what I love and I can be closer to family.
Meritas really has most every need that a patient would have covered. By being a part of that family, some of the communication between those different providers is very seamless, and you really get good continuity of care because of that.
I really appreciate practicing in a big practice full of very competent physicians, because I know if a patient can't get in to see me, they're going to see one of my colleagues who it's still going to be within my system. I can review their notes if there's any concerns.
I also like the fact that North Kansas City Hospital is right here, so if I need to admit a patient, I know the attendings, I know the ER staff, and that connection is there, so I feel confident that my patient is getting the best care at clinic and inside the hospital.
I can send my x-rays for overread, and even later that same day I can be on the phone with the radiologist if there's any concerning findings. I love how fast I'm able to get information back for my patients, because it helps me to provide them timely care.
Whether the patient is in clinic with me or they're in the hospital, I know they're getting excellent care.
Meritas Health provides a very comprehensive care. There are multiple specialties under one roof. It's a hospital that is owned by the community, and there's a sense of community in this hospital.
I initially began looking for jobs at the end of my training in Kansas City because my husband lived out here. He works at North Kansas City Hospital, and he loved the people that he worked with. So when I did my interview, I saw the different people he worked with, and I agreed that the people makes North Kansas City Hospital.